everyone. I am Dr. Sushmitha, Consultant Intervention Pulmonologist, SevenHills Hospital, Visakhapatnam. Today, on the occasion of World COPD Day, let us discuss few things related to COPD, that is chronic obstructive pulmonary disease. COPD is a chronic disease which mainly affects the airways of the lungs, but in severe cases may also affect the lung parenchyma. The most common cause of COPD is due to cigarette smoking. Also, indoor and outdoor air pollution, few genetical causes such as alpha-1 antitrypsin deficiency, occupational exposures may also lead to the development of COPD. Even though COPD is a chronic disease, it is preventable and also treatable condition. So, the diagnosis of COPD involves the clinical symptoms and also history of cigarette smoking. The symptoms include chronic cough, sputum production, breathlessness, which is progressive, also chest tightness and wheezing. We can add few diagnostic tests such as PFT, which can aid in the diagnosis of COPD when in doubt, and also radiology, which may help in seeing the other conditions which are associated with COPD. Patients with COPD can be diagnosed early and managed with simple therapies like inhalational therapies. There are n number of drugs, inhalational therapies, which are available for the management of COPD. So, early diagnosis and treatment helps in prevention of progression of disease along with prevention of the occurrence of its comorbidities. Like COPD leads to n number of diseases such as myocardial infarction, your heart attacks, your cerebrovascular accidents. Then it may lead to chronic anxiety, depression. Also, it may lead to failure of other organs. And untreated COPD leads to respiratory failure. That means your carbon dioxide gets built up in your lung and leads to respiratory failure. So the patient may be bedbound and may be like oxygen dependent for the rest of his life. So early diagnosis and management. Also, prevention is the key for the diagnosis and treatment of COPD. So avoidance of cigarette smoking and vaccination, and the patients who are diagnosed with COPD, by vaccinating them we can prevent exacerbation of COPD. Thank you.